And good morning, everybody, or if you are watching this would be a good evening to you. This is For Your Health, a presentation of Medica Pharmacy. And with us from Medica Pharmacy, Alyson Schwartz. And good morning, Alyson.
Good morning.
It's February.
It is, I know. Can you believe it? And it's still snowing.
Yeah, it is.
Maybe it's just snow falling from the houses anymore. I don't know. I feel like I live in a snow globe these days.
Yeah. You sent me an email yesterday saying we're going to talk about all this stuff about supplements, and I responded back. I had seen an article a few weeks ago, and I know that you believe quite religious. I say religiously, but
close, yes.
Yeah, in supplements and what they can do for people if they're the right supplements, take them for the right reasons.
Right. Yeah. So there was an editorial summarizing 3 different studies in the Annals of Internal Medicine back in December, and then one of our local doctors followed it up with her opinion that she agreed with the people that did the editorial that supplements really are a waste of money and that you shouldn't use them. And so, it's really interesting that another person that put out an opinion on it was Dr. Alan Gaby. Now, for those of you that don't know Dr. Alan Gaby, he is the world-renowned expert on supplements. As a matter of fact, those of you on the radio can't see this, but those of you on the TV can see this, which is, you remember those old school Bibles we used to have that we used to press flowers in? That's how big this book is. So Dr. Gaby has done so much research and reviewed all the literature and all the research on almost just about any vitamin, mineral, or supplement out there, and he's put it together in this book. And he's a big promoter of things like, yes, we need vitamin D, but we don't need the 50,000 unit that most physicians prescribe because you have to convert it in your body to D3. So he says if you look at the literature, you really should just take the over-the-counter 1,000 units of vitamin D3. So he has some great information in here. So I kind of read his editorial that was in the Huffington Post, and if anybody wants to see it, it's a really amazing review and breakdown of these studies. But I'm going to summarize it for you. If you want a copy, I have some at Medica Pharmacy. Please stop by. So one of the things they pointed out in the study is that there was no benefit seen, but the biggest thing they put is stop wasting your money on supplements because not only are they not a benefit, but they could be harmful. Well, there was no harm shown in any of the studies. There was no negative effects. So I'm like, if there's no negative effects, why do you say don't do it because it might be harmful? That to me is almost a blatant lie. And so that, that got people that like supplements a little bit upset because if it's harmful, fine. But if there is no harm, why would you ever say that there is harm? Yeah. So that was the first one. So basically we'll start at the first study. It looked at did vitamins reduce the recurrence rate of cardiovascular events, heart attack, stroke, and surgery. And this is really interesting. It actually found that it reduced your risk of those events by 11%. But it said it's not statistically significant. Well, what that means is that they cannot say with 95% certainty that benefit of the vitamin wasn't maybe due to chance. Maybe it was 94% certain, so then if it is 94.5% certain, it's not significant. Right. Well, the fact remains is it lowered your risk by 11%. So whether it was the supplement or chance, there was a benefit there.
That's 1 out of 10. Even.
Right. So I'm like, okay, well, if it was me and I could have an 11% reduced risk of heart attack, I'm going to take my vitamin. That's a reduced risk. So that was the first one. They said there's no benefit, but yet there was. Okay. The second study found that using a low-potency vitamin, and they used Centrum Silver. Some of you have heard me talk about the fact that Centrum only has about 5% of the supplements of the minerals and vitamins you need to be healthy in it. Mm-hmm. Well, in that study, it said it had no effect on cognitive function. That's your memory. Mm-hmm. So the interesting thing about that, there was also 2 other studies recently done, both of them double-blind, done correctly studies, that showed there were improvement in cognitive functions with supplements. Now the difference is the 2 that showed positive results used 100 micrograms of B12 in one and 500 micrograms of B12 in the other. And B12 is the one they usually study for cognitive function. Now they also had folic acids and B6s in it. Centrum Silver only had 25 micrograms. Well, that's a quarter of the dose. And so you think, well, if it's a really low dose, and maybe it's not going to have benefit, but there's been other studies with higher potency stuff saying it does have an increased effect. It does improve your memory and your cognitive function. The other thing that's interesting to know is that Centrum has 3 artificial colorings in it that are aluminum-based. Now, it's well documented that artificial colorings affect cognitive function in children. They haven't studied as much in adults. But there's been lots and lots of study that says long-term aluminum use can lead to Alzheimer's disease. So how can you take a vitamin that doesn't have enough vitamin B12 in it and has stuff, artificial, potentially toxic stuff in it that could make your cognitive function worse and make any kind of conclusion from it? So that was Dr. Gaby's point on that one.
I have to chime in. Why would you want a coloring to a vitamin?
That is a good question. And really, you don't want coloring to anything. I mean, most of the food colorings that we use in this country, in vitamins, in sports drinks, and whatever, they're not allowed in some of the European nation countries because of their toxicity. So, I mean, you're right. I mean, a lot of people put a food coloring in there because it looks appealing. And some of the food colorings and different masking agents, like Centrum, has talc in it. I'm like, why do you need talc in your vitamin? So, I was looking at the ingredients to compare them the other day, and I just thought, why do you need talc and all these colors in your vitamins?
It's powder, isn't it?
Yeah. I think we use talc to put on our baby butts when they're wet, but I don't know why we need it in a vitamin. But anyway, some of these vitamins, you open them up, and they're bright reds and bright greens, and they're so coated you can't smell them. The first thing to know is if your vitamin doesn't smell like a vitamin, you're not going to absorb it well enough to use it, so don't take it. Okay? So the third study was researching vitamins and minerals to see if they can prevent heart disease and cancer. So the editorial, very interesting, stated there was no clear evidence. However, there was a statistically significant, this time, 7% decreased risk in cancer. Okay, well, nobody likes cancer. So even a modest decrease in risk ought to warrant, maybe let's look at this a little bit further. It didn't show a difference in women. And they don't know why that is. But again, that's something that would be warranted to look into. The third study did not show a beneficial improvement in heart disease. Now, what they think maybe, or Dr. Gaby's opinion is that in those studies where they're looking at heart disease, zinc and copper were not given in balance. Now, we've talked before that everything in your body is designed to be in balance. And when one thing's out of balance, it can cause an imbalance in something else. Well, copper deficiency has long been shown to cause heart disease. And large doses of zinc over time actually induce copper deficiency. So there's in zinc in a lot of vitamins and a lot of things, and you pair that with the fact that over the years, the copper content of foods has declined, then there's, you can kind of deduce that if your copper is lower and you're given more zinc, then you're going to have an adverse effect in a negative way on the cardiovascular system. So those were Dr. Gaby's opinions. So part of what he was saying and some of the other functional medicine guys that really study supplements said is, there's a huge difference between the low potency Centrums and the top of the line, high quality, high potency multivitamins out there. Dr. Ballard in her article pointed out that vitamins don't have to make any kind of claims or follow any guidelines for their effectiveness. This is true, but FDA prohibits them from doing that. But the top of the line supplement companies actually follow the strictest of manufacturing guidelines. They study and test all of their products for purity, for potency, for toxins, for heavy metals, for pesticides, and most of them study their products and do research on them. And they don't make claims, but they don't release products unless they see a benefit of them. So and it's hard to find top-of-the-line vitamins. You cannot walk into Walmart, no offense to Walmart, and get a top-of-the-line vitamin. Mm-hmm. It won't happen. So what I tell people is I started to bring the bottles, but I figured we couldn't really see it on the video. Okay. So stop in Medica and look at the difference between Centrum Silver and the top-of-the-line vitamin and see the difference.
When you say look at, you're talking about turning around, looking on the back.
Yeah, the Centrum, when I was holding it, the Centrum ingredients are about that long on one side and about this long on the other. The top of the line is this long on both sides, and the font is smaller. So there is probably about 10 times the amount of stuff in the top of the line ones. And you'll see, like, Centrum has all the food colorings. The one from Integrative Therapeutics says no wheat, no gluten, no corn, no soy, no artificial colorings, no artificial flavorings. Color variations are normal in their pills. Mm-hmm. So it has no additives. And so the challenge is that Integrative Therapeutics is one of the top of the line, only supplement line sold in the Mayo Clinic. They follow very strict guidelines. They guarantee their products. So if you've been taking some Centrum Silver or some one a day or whatever it is, I challenge you to come in and get one of the integrative products. Try it for the full 30 days. If you can't tell any difference, bring back the bottle and your receipt and you'll get your money back. Okay. I mean, that's how strongly they feel about their supplements. So that's the one thing we want to point out. Bring it all in. Now, I do agree with Dr. Ballard that you can't eat junk all the time and take a supplement and expect it to have a benefit. That is a fact. So she did point out Mediterranean diet lifestyle. That's not always real easy for us to do because we don't have access for some of those Mediterranean foods. But Mediterranean diet's a perfectly fine diet, but there's lots of really healthy diets out there. If you're unsure about that, talk to your doctor, come into Medica, talk to us. We have a few different ways of seeing that people making a huge difference in their lifestyles. So you do need to eat right, and you do need to exercise. You can't just sit on the couch and eat potato chips and take a supplement and think you're not going to have a heart attack.
They're not magic pills.
Right. They're not magic. I mean, we're never saying they're going to prevent it. Will they help you live a healthier lifestyle? They've been shown in hundreds of studies that they can. The one thing I did not necessarily agree with her on is she had two things in there. You need to live a low-stress lifestyle and a toxin-free lifestyle. Well, I'm not sure how anybody can do that. It's with all the stresses we have in the life, and it's not just mental stress, work stress, kid stress, family stress. It's the cold weather depletes you of vitamin C. It stresses your body out. Bacteria and viruses, coughs, colds, illnesses, those are all stresses to your body. So it's about managing your stress. It's not about living without stress. We all have stress. And people that perceive stress as being really awful and I can't handle it, you guys really have a harder time. It affects you more negatively. So it is how you perceive it. And then as far as toxins, I have no clue where you would go to live a toxin-free lifestyle. Yeah. I mean, we're bombarded with toxins in the clothes that we wear, and the foods that we eat, and the lotions that we put on our skin. So that's darn near impossible to do. I thought maybe we could find another planet, and that would be toxin-free. But I don't think you can live toxin-free. I think you have to help your body remove toxins. Drink lots of water. There's been some liver supplements like milk thistle and Silibin that are well proven to help detoxify the liver. So, but you can't live toxin-free. I'm pretty sure of it. Yeah. I do also agree that she said certain people with certain disease states need to take supplements. And if you look around, most Americans have some sort of disease state. So I figure most people probably need a supplement. The study was in really well-nourished people. We have a lot of malnourished people in this country. Yeah. But the one thing she stated is that you cannot rely on over-the-counter supplements. Well, the vast majority of really good over-the-counter supplements are over-the-counter. Now, certain ones of them, like Integrative Therapeutics, they don't sell to just anyone. They are a provider line, so if you aren't trained in their products, they won't allow for you to sell them. So that makes them not truly an over-the-counter product, but basically over-the-counter just means you don't have to have a prescription. Right. So again, you have to know somebody that's the difference. Lastly, what I wanted to point out is that the average American takes one prescription a day. Okay? So I brought this list as a visual. Sorry, you guys on the radio, you'll have to watch it on TV. This list is a list of all the supplements and vitamins and minerals that are depleted from your body from certain prescriptions. So there's a really good chance if you take a regular maintenance medication that you're depleting your body of something. Lots of people take acid-lowering medications. Those deplete you of B12 and magnesium and iron. So if you're on a medication, there's a good chance you need a supplement because you cannot replace a deficiency with food only. Yeah. Okay? So that being said, there was a thing about, going to your doctor for questions about supplements, and that's fair. My problem with it is that medical school, pharmacy school, nursing school, PA school, they do not teach you very well about supplements at all. They don't, because they are not FDA regulated, and there are not these huge, billion-dollar studies paid for. That's really what funds medical schools and pharmacy schools is all these studies by drug companies. So they don't teach you about supplements. So if you really want to know about supplements, you have to take it upon yourself to review the research, to go to the people doing the research, go to the people that are the experts in the field, see what they have to say. I've heard Dr. Gaby talk a couple of different times. He is amazing, wealth of knowledge, and then, like I said, he's got this huge book. But there are other ones out there. But you have to go out among yourself. So whether you've been practicing for 30 years or you've been practicing for 5, if you're not taking it upon yourself to really go out there and do the research and find out what supplements are good and what supplements are bad, then I have a hard time with people making an editorial opinion about it, as do other people. So, the title of the one Annals of Internal Medicine was Enough is Enough, Stop Wasting Your Money. Well, we agree, enough is enough. Enough opinions from non-experts saying it's harmful when there's no harm. Yeah. So,
I've always been under a right or wrong perception that the human body, being as remarkable as it is, sometimes if we put too much of a vitamin or a other supplement like a magnesium, whatever, it can take care of itself. You say it can, but you say sometimes it has I guess we call it a side effect.
It does. And, we see people use B6 a lot. We'll get prescriptions for B6. If you take B6 by itself, it can actually make you deficient in folic acid. Well, folic acid's been shown for years to be protective against cancer. So if you make yourself deficient in folic acid, not only can you increase your risk of cancer, but it's super important to not have birth defects. So the woman and the man both need to have good folic acid to help prevent birth defects in babies. So if you're taking something with too much B6 in it, you might be making yourself folic acid deficient. And then the other one that's interesting is we see prescriptions for certain vitamins and minerals quite a bit. And this to me is always the biggest clue of we really don't teach supplement use, is we get prescriptions for magnesium all the time from our local physicians. And every time we do, it's written for magnesium oxide. Well, one of the first things you learn in pharmacy school about magnesium oxide is that it is not absorbed. So we're prescribing products that are not absorbed and really have no benefit. Now, a good magnesium product will take care of your restless legs, your constipation, your headaches. It'll help you feel more energized. It'll help you sleep better. Magnesium deficiency is widespread, and the problem with testing for this is magnesium deficiency doesn't always show up. So you dose magnesium based on your symptoms. If you're, not having a regular bowel movement, if your muscles are tense, if you're tired, you're probably low in magnesium. And we've had great success treating people that need Miralax, need laxatives. With a good magnesium supplement, you take a couple at bedtime, their headaches are better, they're sleeping better, and they're having a daily bowel movement. I mean, we've had people that only have a bowel movement once a week. I can't imagine. That means you probably have about 20 to 30 pounds at least of fecal matter in your bowels. Now, who wants that? You want to lose weight? You should go to the bathroom every day. So, but that's is always your first clue, is when you're seeing prescriptions for poor quality supplements, do we really know the difference between a good quality and a bad quality? And again, it really comes down to training. Is we're not being trained. You've got to do it yourself. You've really got to go find out yourself.
What's the difference between a over-the-counter magnesium supplement and a prescribed?
Really nothing. You can buy magnesium oxide over the counter, and if they write a prescription for it, we put it on a prescription. So we get lots of prescriptions. We get prescriptions for Claritin and Zyrtec and Allegra all the time, but you can buy all of those over the counter. Okay. So it's just one of those. A lot of times, if physicians are going to write a prescription, because if they really want you to take it and they put it on a prescription, sometimes you're more inclined to get it. To whereas if they say, go to the store and buy Claritin, maybe you won't do it.
Yeah. Okay.
So, but they send a prescription to the pharmacy, you're going to be more inclined to go pick it up.
Okay. We are in the middle of winter, in the middle of cold and flu season.
Oh, yeah.
Again, remind our listeners and viewers and myself what we should be doing or have done.
Well, I mentioned that this cold weather severely depletes your body of vitamin C. So, you get a lot of people this time of year that get nosebleeds, and some people get, blood vessels in their eye that burst, and so you see that red in their eye. That's a vitamin C weakness. Vitamin C makes your blood vessels really strong. So when it's as cold as it's been for as long as it's been, some vitamin C is going to really help your body. When you're stressed, I mentioned vitamin C just gets depleted. This is a stress. This cold weather is a stress. Get outside when you can. I mean, when it's sunny and it's above freezing, go for a walk. Wash your hands. If you think you might have been around somebody with the flu, get some Sambucus. Oh my goodness, that stuff is amazing to stop the flu. I mean, it treats the flu if you have it, but it'll help prevent the flu as well. So, if you got a household of kids and one of your kids gets the flu, get it inexpensive. It's $15. Get a bottle of Sambucus to give it to your other kids so they don't get the flu too. And that way, hopefully, everybody in the house can stay healthy besides the one unfortunate child who got sick.
Sambucus.
It's black elderberry. It's a natural food product, but it is something else. It treats strep throat and stomach bugs, but it really shines in the flu.
Okay. Anything else new at Medical Pharmacy?
No, I know we're really advocating our Parada Pass Robotics pill packing. So if you haven't seen the ad in the Standard, I know we had talked about trying to get some cameras in there at one point to show how that robot works. It is so neat, and what a great thing for you caregivers out there. I mean, all of your medicines in one little baggie, so if you need to go away for a weekend, you don't have to take 10 bottles. You just take a few little packages of your medicine. So it really frees up the caregiver's time. We take care of all the hassle for you. You don't have to worry about, I need to go get in this medicine this week, because everything's filled on the same time schedule. So you're dealing with the pharmacy once a month. Most of the time we'll deliver it to you. It's a great thing for caregivers and patients alike if you're on multiple medicines and are having trouble remembering if you took them. So it's a great program.
Well, remind us, and maybe we'll bring the cameras over and do the show and get some video footage.
Yeah, it's pretty neat to watch it package up those medicine. It's a pretty neat little machine.
Yeah, y'all named him?
I think Trisha does it, and I do think Trisha gave it a name, but I cannot remember what she named it. But we have two different robots. One of them malfunctions some. The new one works amazing, so it has a nicer name than the old robot. The old robot we thought about taking a crowbar to the other day. It was acting up so bad.
Okay.
Technology. It's great when it works.
It is. Alyson, thank you very much for coming in today, and hopefully the people that, if they did not catch this, it is posted up, will be posted up on your medical pharmacy website. So people can view it at their convenience, but certainly think a lot of great information came out today.
Yeah, I hope so. And I mean, it'll be on our YouTube station. For those of you that don't know, we do have a YouTube channel, and it'll be on our website and on our Facebook page. But stop by. I've got lots of different articles that really evaluate those studies to show yes, there is some benefit. Maybe it's due to chance, but there is an increased benefit. But there is no harm. That was the big thing: is don't say there's harm if there's not. If you want to flip through this giant book of Dr. Gaby's, I'll be glad to let you. If it's a vitamin or mineral supplement, it is in this book with lots of data about it. But stop in with questions. If you want to view the list of medicines, or if you have questions about, is my medicine making me deficient in something, I'll be glad to go over that with you too. But definitely the challenge for the supplements, if you're taking a vitamin and you still believe you want to do it, take a good one and do the challenge. See how much better you might feel on a good quality supplement.
Thank you very much. For Your Health, a presentation twice each month of Medical Pharmacy. I'm Roth Stratton, and this is Alyson Schwartz, and we appreciate you joining us today.